I have not noticed. Understand? I don't know that you are doing. Understand? Like this. Not so demonstratively. We were surprised, but it's order.
Yes, ma'am.
We can't do anything. Officially, we don't. Officially. So therefore, do it somehow aside. So communicans branch, yes, it goes to vegetative ganglion, interrupted in it, and then postganglionar fibers are included as a parts of the somatic nerves. So communicans branch. The second branch comes back to the meninges, it's meningeal branch. And there are also anterior, ventral, and posterior branches. The anterior ventral branches form plexuses. We have cervical plexus, we have brachial plexus, we have lumbar plexus, sacral plexus, and coccygeal plexus. To start with cervical plexus, where is formed? Cervical plexus is formed by the anterior branches of the four superior cervical nerves, and it's hidden behind the sternocleidomastoid muscle, located on the deep muscles of neck. The branches of this plexus divided into motor, sensory, and it's also one mixed branch. Let's start with motor. Motor are directed to muscles of neck. What are the muscles? Deep muscles of neck. How they are called? What is it? So you will repeat it yourself. So muscles of neck, deep, the middle and superficial group, the group of the suboccipital muscles, muscles of the medial tract, it will be innervated, and they join hypoglossus nerve to innervate the infrahyoid group of muscles, and one exception from the rule in the infrahyoid group. The sensory part of this nerve gives the branches to the skin of neck. Transverse nerve of neck, transverse nerve goes to the cervical region. Please take photo of this picture also. There are supraclavicular branches to go to the region above the clavicle. And also they go to the external ear, it's auricular magnus branch, and to the occipital region, occipital minor branch. Mixed nerve is called phrenic nerve or diaphragmatic nerve. What does it do? It enters the superior aperture of the thoracic cavity, directed to the sides of pleura, penetrates diaphragm and terminated in the peritoneum. It's mixed, therefore it gives motor part to diaphragm itself, sensory to the internal organs of the thoracic cavity and abdominal cavity, and vegetative to the glands and to the smooth muscles of the vessels in these cavities. Brachial plexus. Let's go to see our specimen. Brachial plexus is formed by the anterior ventral branches of the inferior four cervical spinal nerves and one superior thoracic. Where is here? Brachial plexus surrounds this vessel, and this one is brachial plexus. It's formed two parts. The supraclavicular part, it's above clavicle, and infraclavicular part, that is below it. Supraclavicular part mainly innervates the muscles of the pectoral girdle. The first of them is subclavius nerve. It goes to subclavius muscle. Secondly, it will be the dorsal scapular nerve. The dorsal scapular nerve directed to the medial border of scapula to rhomboid muscles. We never demonstrated on specimen, but it exists. Then we have also the pectoralis, lateral and medial nerves. They go to pectoralis major, pectoralis minor muscles. The subscapular nerve. Subscapular nerve will be here, goes to subscapular muscle. and also it gives the thoracodorsal nerve directed to the latissimus dorsi muscle. The biggest nerve from the short and supraclavicular parts is axillary nerve. Axillary nerve passes the quadrilateral foramen, directed to this muscle, deltoid muscle, also give branch to the teres minor muscle. Skin of this region to cover the shoulder joint also is innervated with this nerve. And long thoracic nerve. Long thoracic nerve goes to the anterior serratus muscle to innervate this region. They were short branches of the supraclavicular part. Now long branches. The first long branch is called medianus nerve. Medianus nerve. It starts from the lateral and medial fascicles which surround the axillary artery, goes through the medial bicipital sulcus, doesn't give any branches here, then enters the forearm region, goes beneath the pronator teres muscle, here is it, innervates nearly all the muscles of the anterior compartment of forearm, with two exceptions. It does not innervate only flexor carpi ulnaris muscle and adjacent part of the flexor digitorum profundus muscle. Other muscles are innervated. You should repeat these muscles. Enters the surface of palmar side of wrist, were divided into the common digitorum and then the proper digitorum branches 2 fingers. It innervates 3.5 fingers. So parts of 3.5 fingers. Also, it goes to the muscles of the senar eminence. So to the abductor pollicis muscle, to the superficial head of flexor pollicis brevis muscle, opponens pollicis, it will be deeper located, to the first and second lumbricalis muscles to innervate this region. The next long branch is called ulnaris nerve. You see, ulnaris nerve is originated from the medial fascicle of the brachial plexus, goes to the medial bicipital sulcus, again doesn't give any branches in arm region, surrounds the medial epicondyle, directed to the homonymous sulcus, it's the ulnar sulcus, innervates 1.5 muscles here, which were not innervated by the medianus nerve, directed to the retinaculum flexorum, given here 2 branches, the palmar and dorsal. Palmar innervates 1.5 fingers, and the deep part of it goes to the muscles of the hyposenar eminence, to the abductor digiti minimi muscle, to the flexor digiti minimi brevis muscle, and to the fourth and third lumbricalis muscles, all interosseal muscles, as well as adductor pollicis and deep head of flexor pollicis brevis muscles are innervated. And dorsal branch goes to 2 fingers and a half. So goes to 2 fingers and a half, starting from the 5th one. It's dorsally. The next long branch is called radialis nerve, radial nerve. Where is it? We'll get artery, and behind artery, there is a radial nerve, nervus radialis. Starts here behind artery, axillary artery, enters the humeromuscular canal. In this canal, it innervates the posterior group of arm muscles. Then it goes out the canal, and we can see it here when it exits canal, humeromuscular canal. After it divided into superficial radial and deep radial nerve, the superficial one forms the innervation for the brachioradialis muscle, extends the carpi radialis longus and brevis muscles to this radial subgroup of the posterior forearm muscles, and terminated in the dorsal side for 2 fingers and a half, starting from the first one, to skin of this region. The deep branch penetrates supinator and goes to all posterior group of the forearm muscles. One more nerve in this long group of plexus is called the musculocutaneous nerve. What does it do? It goes to the anterior group of the arm muscles. So to them, it's biceps brachii, coracobrachialis muscle. The brachialis muscles are innervated, and then continues into the forearm region as the lateral cutaneous brachial and antebrachial nerves till the skin of senar eminence. Medially located branches, which were not preserved here, only remaining parts of them, they are called as the medial cutaneous brachial and antebrachial nerves. They go to skin of the arm and forearm regions. They also branches of the long part of brachial plexus. Well, what we can see here, we'll show it one more time. It's medianus nerve, we can see it here. The ulnaris nerve, we'll have it here. The musculocutaneous nerve. Then behind it, we'll get the radial nerve, this one, long branches, which should be demonstrated. The topic is difficult and one of the most important for this semester. What you should do, you should remember all the muscles. As far as I understood, it's a big gap in your education. So all these muscles should be studied, pelvic, pectoral girdle, and the muscles of free upper limb, and then nerves. So cervical plexus, brachial plexus, and formation of spinal nerve. It will be your home task. So do it, please. For those who would like to have colloquium, please take the part of brain.